Nursing instructions and oral care practices for a patient with radiation oral mucositis. Gentle mouth cleaning. Use gentle, pH-balanced rinses. Rinse the mouth every 2 to 3 hours with a mild, non-alcoholic solution, e.g., salt water or baking soda solution, 1 teaspoon baking soda or salt in 8 ounces of warm water. Use saline or baking soda rinses, which are gentle and effective in loosening thick saliva without causing irritation. Why are saltwater rinses with high salt concentrations not ideal? Concentrations higher than recommended, 1 teaspoon salt per 8-ounce water, can exacerbate dryness and irritation in the mouth. A mix of half a teaspoon salt and half a teaspoon baking soda in 8-ounce water is milder and helps maintain oral pH while soothing mucosa. Use a soft bristle toothbrush or a sponge applicator for brushing to remove any thick saliva or debris gently. Avoid further irritation. Rinse mouth thoroughly after meals and before bedtime. Encourage steam inhalation or use a humidifier to moisten oral tissues. For dry, cracked lips, non-medicated lip balms, e.g., petroleum-based products, may not provide enough hydration or healing properties. Use a lanolin-based or medicated lip balm for better protection and healing. Use small amounts of pineapple juice or papaya juice to help break down thick saliva, if not contraindicated. While these juices contain enzymes that help break down mucus, they are not ideal. The acidity can further irritate ulcerated or sensitive mucosa. Avoid alcohol-based mouthwashes, tobacco. Many antiseptic mouthwashes, e.g., Listerine, contain alcohol, which can cause significant burning, dryness, and irritation to already damaged mucosal tissues. Excessive use of antiseptic mouthwashes can kill both harmful and beneficial bacteria, disrupting the natural balance of oral flora and potentially increasing the risk of secondary infections, like oral candidiasis. Limit use to when absolutely necessary and prioritize soothing, non-disruptive rinses. Antiseptic mouthwashes may contain harsh ingredients like chlorhexidine or hydrogen peroxide, which can irritate open ulcerations and delay healing. Patients with mucositis often experience altered taste or heightened sensitivity, making the use of strong-tasting antiseptic mouthwashes unpleasant and reducing adherence. Avoid whitening toothpaste or products with strong flavors that can irritate the mucosa. Conditionally use fluoride toothpaste or a prescription fluoride gel to prevent dental issues. Fluoride gels or toothpaste may sting if applied to ulcerated areas and could cause discomfort. Wait until ulcers begin healing or use a fluoride rinse designed for sensitive mouths. Limit hot foods and beverages, which can exacerbate pain. Pain relief. Apply prescribed topical analgesics, e.g., viscous lidocaine, directly to sore areas before eating or oral care. Take systemic analgesics as prescribed if the pain is severe. Stay hydrated. Sip water frequently or use artificial saliva substitutes to manage dry and thick saliva. Suck on ice chips or frozen fruit pops to keep the mouth moist and soothe discomfort. Conditionally, use ice chips for moisture and pain relief. Why is it not ideal in all cases? Patients receiving certain types of radiation may have reduced saliva production or a risk of tooth sensitivity, making ice chips less comfortable. Prioritize frequent hydration over extreme measures like acidic juices or ice chips. Dietary modifications. Avoid acidic or spicy foods entirely. Opt for soft, bland, and moist foods, e.g., pureed vegetables, mashed potatoes, scrambled eggs. Avoid rough or dry foods like crackers, chips, or toast. Monitor and report. Watch for signs of infection, e.g., white patches, fever, increased redness, or swelling. Notify the healthcare provider if symptoms worsen or new issues arise, such as difficulty swallowing or severe bleeding. Emotional support. Reassure the patient that oral side effects are common with radiation therapy and provide emotional support. Encourage the patient to adhere to the oral care routine, emphasizing its role in recovery. This comprehensive approach will help alleviate the patient's symptoms, maintain oral health, and improve comfort during head and neck radiation therapy. General consideration on holistic care. Ulcerations in the oral cavity can easily lead to fungal or bacterial infections. The plan should include advice to monitor for white patches, suggestive of thrush, and emphasize regular checkups. Incorporate antifungal or antibacterial rinses as needed based on risk factors. While viscous lidocaine is effective, systemic pain control, e.g., acetaminophen, should also be included for patients if topical agents are insufficient. Some patients may find sponge applicators or alternative tools more comfortable than soft toothbrushes. Patient preferences should be fully considered.